Mnemonic is no longer used for treatment of heart attacks.
Oh hi, I'm Mona from her restaurant.
This mnemonic stands for morphine, oxygen, nitrates and aspirin. It might do more harm than good because it doesn't include the use of potentially beneficial drugs. A new mnemonic, known as THROMBINS2, is proposed to include a wider range of treatment options, which includes phenylpyridines, including prasugrel and clopidogrel. Platelet activation is inhibited differently than aspirin, so provides a dual antiplatelet blockade. Even though there is an increase in bleeding, the modest decrease in cardiac events warrants their use for routine management. Heparin, including enoxaparin. Unfractionated heparin is still commonly used because of its low cost and reversibility. Low molecular weight heparins, like enoxaparin, but their long duration of action puts them at odds for patients who are likely to undergo percutaneous coronary intervention or cardiac bypass surgery. Renin-angiotensin system blockers. Using angiotensin-converting enzyme inhibitors, or angiotensin receptor blockers. They attenuate ventricular remodeling after acute MI, which improves mortality. Oxygen therapy, if patient is hypoxic. Morphine.
It's morphine time!
For pain control and relief of symptoms. Despite its ability to decrease oxygen demand on the myocardium, it does not improve the outcome. Beta blockers. Reduce heart rate and myocardial oxygen consumption, improving outcomes in patients diagnosed with acute MI. They should be started within 24 hours of MI. Contraindicated in heart failure, shock, heart block, PR interval greater than 0.24 seconds, second or third degree heart block in patients without a pacemaker, asthma, and reactive airway disease. Invasive surgery to widen the blocked coronary artery.
I'm having surgery.
Should be considered with all patients with ACS. Patients with non-ST elevation ACS who have refractory angina or hemodynamic or electrical instability may require immediate treatment via an invasive strategy. Nitroglycerin. Decreases myocardial oxygen demand and help deliver oxygen to ischemic areas in the myocardium. But not shown to have a significant effect on mortality. Statins. New guidelines suggest a high-intensity statin for patients aged 75 and under, and moderate-intensity statin therapy for patients over 75 with coronary artery disease. Salicylate, aspirin.
Wow, that aspirin dance really works.
Aspirin is the only drug in the original mnemonic that proves to be a good option for most patients with coronary artery disease.